This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D-HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Well, if you haven't been outside yet, I'm happy to inform you that it's much cooler than it was yesterday. So it's a good day to walk on the beach, walk on the boards.
Walk in town.
Walk anywhere, okay? Good to have you with us as always. Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. And as you heard the man say, Dr. Molly FANTASIA is here, the PhD doctor and the executive director and the founder of Innovative Medical Associates, located in Marlton, New Jersey. What do we talk about here on the show? We talk about all things related to your health and specifically how Dr. Molly and her staff can help you and your family improve your overall quality of life, how they do it and why they do it and when they do it. Well, we'll talk about that here on the show. 855-839-1210 is the number in the studio. At any time, if you have a question or a medical challenge you want to run by Dr. Molly, that's the time to call in right now. 855-839-1210. Health Watch, Sundays, 8 till 9 here on Talk Radio 1210 WPHT. And once again, Dr. Molly, it's the age-old question. So what do you do, Dr. Molly?
I know, John. And, no matter how many times we go over this,
yes,
all right,
I know.
Invariably, I still get that question during the week.
And especially in a consultation, right?
Right. I don't understand. How does this work again? Well, it's pretty simple. We are a licensed primary care facility. The group of healthcare providers I have work out of my facility, and we can do anything. All the docs can do anything that any other, like family practice or general medicine guy can do. So if you have a hangnail, he can probably help you take it out. If you have an infection, he can write a prescription.
A cold.
Right. Anything, okay, we can do. But philosophically, what we believe is that, and what we've seen work, is that we want to reduce the amount of prescription meds a patient needs to effectuate the change of the challenge that they have when they come to see our physicians. So, that being said, why do we want to do this? Because of the side effects. We want you to have a good quality of life. I want to caution people because I had this question this week. Oh, Dr. Molly, you're going to tell me throw away my cancer meds. No, I'm not.
You've never said that.
No.
Ever.
No, I'm not. Of course, we want you to use whatever medication we need to help you get through the medical challenge. What we want to do, though, is augment with what we do and maybe, just maybe, ultimately get you off some of those meds or reduce some of those meds. And therefore what? We reduce the side effects. John, you know it because you have a couple of problems, right?
Yes.
A couple of conditions.
Yes.
And thank God your medication is fairly limited.
Yes.
It's a good thing.
That's exactly right.
And you're doing well. All of your specialists say you're doing well. Well, you are a prime example of what we do and how well we do it. We're never going to tell you don't take your meds. That's absolutely not the case. But we're going to augment with the natural substances, things that you could find in the health food store, vitamins, minerals, amino acids, those types of things that will actually effectuate the change and really help you have a better quality of life.
And you've also been able to give me and other patients information and sometimes advice on what medications to consider for a particular problem.
Listen, that's the beauty of having, the joke in my place is 3 doctors, no waiting. Isn't it wonderful? Now, the other side of that, John, there's an old joke too. It says 3 doctors, 6 opinions. So the point of this is that if you come in and you have a question and you may be suffering from one of the side effects of the medication, obviously our medical physicians will be able to help you maybe reduce that at another type of drug within the category, maybe to help you. Wonderful thing with that is blood pressure, John.
Yes.
I mean, we see a lot of people still to today come in to see us with cardiac issues, okay? And we found that one of our patients, who was a long-standing patient, he was having a bout with his blood pressure meds, in that they were dropping his pressure too low. So he went from hypertension to hypotension. And what had to happen was, what the good doctors did was, because he was so faithful with the hydration and the chelation, when we actually sent him to the cardiologist reduced the blood pressure medication.
So it worked.
It worked.
It worked. The combination worked right there.
Exactly. And of course, we sent him to a cardiologist who's aware of the kind of work we do. And it really did work for this patient. And he's a young guy, and he's happy because why? That medication was contributing to his ED as well. So it's a good thing.
And you did the same thing with me. We were talking about medication for cholesterol.
Of course.
And many times the doctor prescribed this and it didn't work.
I know.
And finally, after probably 6 or 7 tries, we got one that's good.
Right.
And now it's working very well.
Right. And you're not suffering side effects from it because you're not on the largest dose of it.
Right.
And that's the key. So the fact that you come in twice a week is helping you maintain your cholesterol and lipid levels and your blood pressure and maintaining your cardiac status. So that's all we can ask for.
So in your facility at Innovative Medical, it's the combination of the hydration helping you to maintain your lifestyle, your overall health, so that you don't have to depend too much on prescriptions.
And hopefully become a helper in improving whatever condition you have, so that you can use the least amount of the pharmaceutical to effectuate the change.
And the other question you get on just about every consultation, you love this question. Dr. Molly, does this stuff work?
Here we go again. But here, look, if you want quantitative data, I have it. I can show somebody who's come in and had a 500 cholesterol, and now it's down to 200 or 100 or something like that. But you know what? The best thing you can do is come in and talk to other patients who have problems similar to you. That will do the trick, I'm telling you, because people... It's an interesting place, because I have to always worry about HIPAA, but my patient-to-patients never have to worry about HIPAA, and they'll tell you plenty.
It's very interesting, because when somebody asks, does this work, I say, and they'll ask me, how long have you been going? 20 years.
Oh, I know.
I guess it works then, huh?
Yeah,
So,
I know. Now, look, of course, the biggest thing I see today are these chronic conditions, John, that absolutely have to do with our lifestyle. It's a rough life out here right now, right?
Yes.
We just got off of COVID, depression. I mean, I'm seeing so many different types of conditions now that, I think are all related to, what has happened to us over the past year.
in your experience, and you've been doing this now, I think you're going on, 26 years? 25?
Yeah.
Okay. 25 years. And in your experience with hydration therapies, is there one area where it works best or where it really is most helpful to patients?
Well, I think that's the beauty of the delivery system. The delivery system is the hydration, but it's actually the natural substances that I'm able to utilize for particular problems that effectuate the change. So we've seen people with chronic pain, like arthritic pain. We've seen have really good improvement. We've seen people who have cancer who really have been doing really well. They're not getting rid of what their traditional oncology, but we're helping them get through a lot of the oncological drugs. And I'll tell you, many of the people with cancer tend to be more fatigued, et cetera, from the remedy as opposed to the condition. And they're finding that they're able to get through without harming any of the good stuff that the drugs do.
Which is a large part of your practice.
Right
is
now
the cancer
yes.
support.
Yes, it is.
Unfortunate, but you are able to help people because of that fact.
Of course. And, every patient is different. There's not one size fits all in my clinic. But I tell you, I think overall, I would say somewhere between 5 and 15 weeks, people start to feel really good.
All right, we're coming up on our first break of the morning. Our show is Health Watch, and you'll find us here every Sunday from 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We always tell you that if you have a question, you have a thought for Dr. Molly, early is a good time to call because we want to make sure that we get your call in and Dr. Molly has some time to answer your question or your issue. 855-839-1210 is the number, 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return. More of today's Health Watch after these words. Welcome back to Health Watch. As always, when we're on the program, operators are standing by at Innovative Medical Associates, and of course, they are there right now. If you want to talk to them, you're a little bashful about coming on the radio, well, you can call them and ask them some questions. But the most important thing you can do for yourself and for your family is to make an appointment to sit down with Dr. Molly. The initial consultation is complimentary, and all you have to do is call 856-489-0505, 856-489-0505. It's Innovative Medical Associates, Marlton, New Jersey. And you can also check them out on the web, innovativemedicalassociates.com. A lot of good information there. Innovativemedicalassociates.com is the website. And our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. We're going to the phones. Mike is in Jenkintown. Mike, good morning. You're on Health Watch with Dr. Molly.
Hi, Mike.
Hey, good morning.
Good morning,
Doctor. Thank you to take my call.
No problem, sir.
I listen to your show every time, and I like it.
Thank you.
And I like if you can tell me what's the best way to test thyroid, except the blood test.
Thyroid testing, you're saying, for your thyroid,
Yes.
right? Okay.
Yes.
Have you been diagnosed, Mike, with hypo or hyperthyroid in the past?
No, that's everything. Blood
that's
test showed it's good.
Ha, yes.
That
Okay.
is normal.
So,
But,
yes, I know.
My symptoms
Don't
show me
support
so
that.
That's not
Yes.
correct.
Let me tell you something, Mike. This is the age-old dilemma that lots of patients find themselves in, because most physicians, or many physicians, particularly those that are conventional in their thinking, endocrinologists, they live and die by the blood tests, right? This is what they say works. However, there are many physicians, and more lately, who are coming out and realizing that possibly you should treat thyroid based on what the patient is feeling, what symptoms the patient has. Is he tired? Is he exhausted? Is there weight gain, weight loss? These kinds of issues, and they're more qualitative. So my suggestion is you make a complete list of your symptoms. You talk to your physician about possibly looking at something called T3, T4, besides the TSH test. And there's also a test that a lot of integrative physicians use called reverse T3. So the body needs T3 to really utilize in order to make the thyroid work at an optimal level. Now, you've got to find an integrative physician for that. And there are many physicians out there that subscribe to a school of thought that this reverse T3, the body perceives it as real T3, therefore it doesn't really put out more T3, the traditional T3, the real T3 you need to really have the thyroid function in an optimal manner. To find those physicians, I would suggest you go on to one of my organizations, the Integrative Society for Medicine, and also ACAM. And you can look that up, or if you call my office, I can put you in touch with maybe someone close to you. Okay? How's that?
It's very good. Thank you very much.
You're welcome.
All right, Mike. Thank you, and good luck with that. Call Dr. Molly's office.
Yeah.
That's probably the easiest thing to do.
It is, and I will give him some of the physicians who are in my organization that I know, maybe closer to him. They don't do hydration therapy, which they should, but they don't. But that really specialize in the thyroid problems. In our facility, our physicians definitely subscribe to this school of thought. And in addition, they actually put a patient on a certain amount of hydration therapy to sort of also give the thyroid what it needs nutritionally to then move in an optimal manner.
Thyroid is one of those
wobbly things.
Yeah,
thyroid is very hard.
It's just one of those. And I had a friend of mine years ago, and I took her into you, and you looked at her, and in 30 seconds, you said you've got a thyroid problem. And you helped her get well.
Well, sure.
And she ended up having surgery.
I remember my doc and I looked at her, and it was absolutely. He said, "Boy," he goes, "Right." Well, I said, "All you needed to do was look at the eyes." And
exactly.
things.
So,
but
you know, it's one of those things that it's another one of those problems that could go a million ways.
That's right. Yeah. You need to have a good clinician help you with that.
All right, 855-839-1210. That's our number. If you have a question for Dr. Molly or a medical challenge, as Mike just was talking about, feel free to call in at 855-839-1210. We're going to spend a few minutes here on the show today to talk about something that Dr. Molly doesn't usually talk about, but it is important, and that is the lymphatic system.
Right.
What is that, Dr. Molly?
Well, you know, the lymphatic system is a very important system for the overall immune health. It is a fluid transport system, okay, that actually is related to our overall health because it's very involved with removing the toxins or the bad bacteria or dead cells from our bodies. But what's interesting about this system is many times it's overlooked. It's overlooked.
Yes.
Because it's not something that you can really sit down and try to keep it simple. That's the point. It's pretty complex. And again, this is God's handiwork at best. So one of the things that it really got to me in the last couple of weeks is that I've been reading more and more from a particular physician's work. His name is Dr. Kipnis, Kipnis, and he actually is a neuroscientist, so he has a PH.D., and he works out of Washington University in St. Louis. He actually discovered that there are lymphatic vessels around the brain and the spine. Now, that may explain some of the role of the immune system in brain health. Now, that's a theory that hasn't really been said before, because if you think about it, conventionally, we've always said nothing penetrates the brain-blood barrier. You'll hear that a lot in traditional medicine. Well, he's shedding new light on this. So from my perspective, I've always been very involved in making sure that the lymphatic system is addressed when we are doing hydration nutritional therapy. And the reason being is because the immune system is really regulated many times by a stronger immune system comes about from a stronger lymphatic system, because it's the lymphatic system that keeps you healthy by increasing the supply of T cells and B cells. These cells mark and destroy any of the foreign bodies which might otherwise cause an infection. It also lowers the risk of cancer, because the T cells prevent cancer, and they do so by kicking off a programmed cell death. That means the old cell dies, and it allows the body to make new cells in its place. But when that's dysregulated, you have a problem. And you know when we see lymphatic really rear its ugly head? Many times in breast cancer, because these lymph filters are right under your arms, they're in your groin, they're in many places, they're in your gut. And so, but pronounced, we see it because lots of women post the mastectomy, you'll hear they have a problem where they have a lymphatic problem on a particular side arm, right? And have you heard about that?
I've heard about it, yes.
Of course. So the thing is, you want to make sure that you can keep this lymph moving. And when I say that, there are certain things, of course, nutrition being one of them, and delivery and hydration is another way by which you keep your lymphatic system draining. There's 20 liters, approximately 20 liters, may not be quite that much, 20 liters of plasma move through the body that deliver the nutrients to the cells. Do you hear that?
Yeah.
20 liters of plasma. Now, plasma is found what? In the blood, right?
Yes.
It's the liquid part of the blood. About 17 liters of this return into the circulation. So this is a closed system. Very unique. God is wonderful. He put this whole thing in place for us to be protected from outside invaders. So approximately 3 liters then return into the capillaries and they go back into the tissues. So that 3 liters is the junk. It's the junk that the body's excreting. So what do you want to do? You want to stay hydrated, because then it goes through the kidneys, it goes through the liver, and you can pass it out through your kidneys and your urine, and you can pass it out in your bowels.
So this is where your hydration comes into play.
You better believe
with regards to the lymphatic system.
You better believe it, because the lymphs collect and remove this excess fluid out. And ultimately, into the bloodstream goes the good stuff, and the bad stuff gets out. So, when I hear people tell me, well, my doctor said you just pee out all the vitamins. Well, yeah, okay. You do. But I'll tell you what.
But they're in there first, right?
Yeah, and they're in there, and what happens is it balances the bodily fluids, okay? And it also maintains healthy blood flow so that it can go down to the tissue that's needed. In other words, it goes to the blood cells that need the nutrition. So this is the bottom line. So when I talk about immune, it's all about the lymphs. And even the new drugs that are out today, the new drugs, in particular the cancer drugs, the immunotherapies, they're working on the lymphatics because they're working on the T and B cells.
All right, we have plenty more to talk about on this. We're talking about the lymphatic system. And, of course, if you have a question for Dr. Molly, 855-839-1210 is our number, 855-839-1210. We are at the halfway point of today's edition of Health Watch. And, again, if you have a question for Dr. Molly, she is here, Dr. Molly Fantasia, the Ph.D. doctor, and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. Again, that number here in the studio, 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return more of today's Health Watch after these words. Back here on Health Watch, and as always, operators standing by at Innovative Medical Associates. You want to make an appointment to sit down with Dr. Molly? That's probably the best thing you could do for yourself and your family. Kind of get a lot of your questions answered and really get a direction as to where you should be with your health. 856-489-0505 is the number. 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. And again, that number, 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And don't forget our Health Watch replay. Yes, this afternoon, 4 until 5. You missed any of the show this morning, we have it replayed for you from 4 until 5 Sunday afternoon here on Talk Radio 1210 WPHT. This is our live version of Health Watch, and we're going to the phones. Frank is in the great Northeast. Frank, you're on with Dr. Molly.
Hi, Frank. How are you?
Good morning, Dr. Molly. Good morning, Mr. DeMasi. How you doing?
How you doing, Frank?
Good.
Nice to hear
talk
from you, Frank.
I know. I'm always your number one fan.
Good.
That old test, acetylcholine ganglionic receptor.
Yes.
Quest Labs cannot do it. They said due to corona they don't have all supplies they need.
Right.
They did test for 15 different allergies. They did test for 15 different antibodies.
Mm-hmm.
14 were normal. 1 came back positive, but they won't tell me what that test means. It's Z as in zebra, I as in Isaac, C as in Charlie, ZIC4. All she says is it's an autoimmune response.
Right.
She kept indicating the same as acetylcholine. Could be a tumor, this and this, see your family doctor. They said it's nothing to do with cancer. I contacted Fox Chase Cancer Center. They said they have no idea. It's not cancer, but they have no idea what that test is.
Thank God. It sounds, Frank, and I have always felt like you have a neurodegenerative problem. You know that, and I think you'll agree with that. First of all, you're a very smart guy, okay? You've been through a lot, and you have a lot of issues. I thought that initially they were trying to rule out, you can't say that. They're trying to narrow down your diagnosis, right? You got to narrow it down, right? So I thought that they had pretty much narrowed it down to some type of neurodegenerative disease. You're going to a neurologist, right?
What she narrowed down was the acetylcholine being elevated. She says
Yes.
it's inflammation, some kind of autoimmune. They were
Yes.
trying to figure out what autoimmune was.
Right.
I saw that ulcer in my foot for a year and a half now. On Monday, a nurse was here. She used to work in neuro. She looked up that Zic. She said it's a rare something. I forget. Only 5% of people. It's very not too much research in it.
Right.
But all my symptoms, Dr. Molly, including dry mouth, exacerbated allergies, vision problems, neuropathy,
Yeah.
it's all a symptom of Zic-4.
Well, these genetic let me tell you something. These genetic polymorphisms, Frank, are very, very difficult. They're difficult to diagnose. You have a polymorphism. You have an abnormal genetic test there. And the question is, what does it affect? Well, I have to tell you, that can go on for the next 5 years by the time they can, they compile all the data. You have a very difficult case.
Well, she wants to see me in person one more time. She
Good,
wants to start immunotherapy, IVIG.
Yes, of course,
But
of course.
I got to wait for an opening. But this is a kicker, Dr. Molly. She asked me before we got the results back, because she stopped, nothing else is working. Medical marijuana. I said, okay. I'm playing around with that, but nothing's. If it works like everything else. It works in the beginning, it stops working. I'm taking capsules because the cream, I couldn't do other things. I can't do vaping. I can't do tinctures.
I got you.
Am I supposed to be more CBD, less THC, or more THC, less CBD? I'm trying to figure it out.
Well,
Which one do you think?
I think more CBD and less THC, but you do need a little bit of the THC from every. And again, I'm not the medical marijuana expert, but I have one in my office. What I do know is you need a little bit of the THC to push it into the cells. So the question is, Frank, it just sounds like, again, you've got a mystery diagnosis. I think they're honing in on its neurodegenerative. The question is, what's going to help it? God bless you,
All right,
Frank.
Frank,
This is
thank
a
you.
long-
Yes. Thanks for the call. We do appreciate it. And you can call Dr. Molly during the week in her office, and certainly feel free to call her and ask her any more questions. But listen, nothing's easy, right?
Poor Frank, he's been fooling around with this for over a year. And again, I've tried my best, but this is an obscure kind of thing. When you have these rare genetic diseases, and by the way, I have another patient with PSP who, who has been doing better with the regenerative medicine, but still not, where she wants to be. And the question is, when you only have these rare genetic diseases, there's no money in them for big pharma to pursue them. And that's the problem. There's not much research in it.
All right, 855-839-1210, our number here in the studio if you have a question for Dr. Molly or a medical challenge, as you've heard some folks call in with this morning. 855-839-1210. Before we get back into talking about the lymphatic system, just want to mention Dr. Molly has her new book coming out on August 1st.
Right.
It will be available on Amazon.com, right?
Right. Kindle first. And
Kindle
then,
first, and then
the print version.
Okay.
Yes.
Dr. Molly's new book. What do we have a title?
Yeah, God's Ingredients 200.
Okay. All right. God's Ingredients Part 2. So we'll remind you again when it comes out.
Listen, John.
August 1st.
I'm a big believer. I don't believe we can improve on the beauty of the body. I don't. I mean, God, this is a perfect body with God's design in mind. All we can do is keep aiding it, whether it's from pharmaceuticals in the proper doses and nutritional medicine.
Okay, we're talking about lymphatic system, and
Yes.
it's not something
It's a
that
little
was usually
complex,
it's a
yeah.
little complex, but the hydration comes into play because
Yes.
it helps
It
the
delivers-
lymphatic system, right?
What you want to do. Listen, you're always talking about what? You're always talking about keeping your immune system up.
Yes.
Well, the lymphatic system is the freeway that does that. Okay? It's the lymphatic system. It makes multiple stops along the way in the body. The lymph composition, which means the fluids in the lymphs, are always changing depending on where it is in that freeway. If you think about this, blood circulates, it flows back to the heart, but not all of it. Some of it stays behind in the intestines and becomes intestinal fluid. Once it's reabsorbed into the lymph nodes, it's called lymphatic fluid. So what do you think happens? The lymph stops by the spleen, flushes out the bacteria, anything that's dangerous to the immune system. When the lymph also goes to the bone marrow. It picks up the immune cells I was talking about earlier, the T cells, the B cells, right? And what happens, these immune cells, called lymphocytes, then transport blood to fight infection. At the end of the process, though, the lymph is reintroduced into the bloodstream, and some of the plasma, again, we'll start this all over again. So can you see how complex this is?
Yes.
But what's the bottom line? You need hydration to keep fluid balance. You need to look at the nutritional support that we give the immune system, and then we want it to be free-flowing. So you do this by looking at antioxidants. I'm going to tell you, your old friend vitamin C
right.
helps improve this. You do some exercises like trampoline. You've heard about that, where people bounce up and down on these things. And all of that really helps move the lymphatics. And I have been a big believer in this for at least 20 of the 25 years. And we, in particular, use it a lot for my cancer patients, of course, because we want to maximize the lymphatic drainage that patients have. But the thing that's amazing to me right now is this new data that's coming out about the lymphatic system being around the brain and the spine, because for years we just didn't know that. We didn't know it. And now we do, so it can really help. There may be an immune issue related to things like Alzheimer's and dementia. We knew that there are many antioxidants and anti-inflammatories that help the brain. But this may help explain why some of these things help to improve the communication between the neurons.
I was going to ask you, you just mentioned it. You said earlier that maintaining the lymphatic system is for good brain health.
Among other things. Yeah.
Can it be a preventative, or can it help with Alzheimer's?
Yes. They're thinking, this is what the good doctor at WashU is saying in St. Louis. He's looking at this because he's saying, okay, is there an immune portion? We know, for example, that the brain can become infected with viruses, right? Didn't we have this with just COVID?
Yeah.
There is a brain. So does the lymphatic system help fight that? I would say yes. Now look, don't put me on the records because this is a theory, guys, but I would say that this good doctor's onto something, because if you think about it, we've heard about viral meningitis, right? And the terrible thing it causes up the spine, right? Well, maybe if the immune system is strengthened, i.e. through the lymphatic system, maybe, just maybe, patients would do better.
So it's a theory that encompasses a lot of different challenges.
Yes. And I'll tell you, John, in the end, how do you maintain a healthy lymphatic? Okay, proper diet, right? What do you think you have to watch? Sugar, again. Sugar, refined sugars. You've got to watch processed foods. Why? Because of all the stuff that's in the process. You really should load up on what? Herbs, greens, these kinds of things. And you know what else? You need to stay hydrated. And where do you get all the extractions from all the good food out there? You can get it in your hydration if used properly.
So we could probably spend 10 shows on the benefits of hydration. Exactly. just listing them.
Of course. And that's what happens. But what we want to do, we have to realize that there's more than ever evidence saying that there is a relationship between the immune system and brain-threatening diseases. And it's been proven with COVID. There's the thing. That's why I brought it up today.
Yeah.
Because this post-COVID stuff, John, is nothing to laugh at.
I know that. I've had a couple friends who are still in the throes of it.
Oh, so. I can give you a story after the break.
That's right. Coming up on our final break of the morning, if that means you still have time to jump in with a question or two, if you have for Dr. Molly at 855-839-1210, 855-839-1210. The show is Health Watch, Sundays 8 till 9. You're on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, executive director, and founder of Innovative Medical Associates, Marlton, New Jersey. And I'm your host, John DeMasi. We are coming back with more of today's Health Watch after these words. Back here on Health Watch, operators standing by right now at Innovative Medical, and they will be there well after we leave you at 9 o'clock this morning. So feel free to call 856-489-0505, 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. Give them a call, and really the most important thing you can do is schedule that initial consultation, which is complimentary with Dr. Molly Fantasia, and you can get a lot of your questions answered and get a lot of good information there. 856-489-0505, and the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly, we've been hearing in the news lately, the COVID cases are up, and you got to get the vaccine, and they're coming back to that kind of thing again.
I know, John.
And you have some patients. They call them long haulers,
right?
And post-COVID issues.
Post-COVID, and one of the things that we found with this, I think I mentioned this, a young man in his 30s who is my patient, and I said he had low testosterone, low T, and brain fog, lots of brain fog. Well, he's had 15 treatments now. The brain fog has pretty much cleared up. And again, it goes back to what? The lymphatic drains, okay? Because viruses are some of the things that the lymph should be attacking and didn't in this case because he was overworked, stressed, and everything else that goes with it. Plus, he wasn't eating a very healthy diet. I also have another case of a young woman. She's in her 50s. Now, granted, she has some comorbidities where she has some autoimmune problems, so she really wasn't a candidate for the shot, for the COVID test. In fact, her infectious disease doc said it was a good thing that her rheumatologist told her, don't get it, the shot. But she really had a bad bout of COVID. She was hospitalized. She came about when they hit her with the antibodies, right? But she was suffering from the post-COVID. She had ground glass look. In other words, it was a pattern that was in her lungs, and that's left over from the COVID. It's it's not rare at all. Post-COVID, people have a lot of problems with their lungs. She started with us. She's now done 30 treatments, and we got rid of most of that pattern in her lungs. She had it in every lobe. Now she has it down to one lower lobe after 30 treatments.
That's great.
And
That's
boy,
great.
does she feel different. And this is someone who has a comorbidity of fibromyalgia and rheumatoid. So the fact that she's feeling better, it's actually encompassing both kinds of conditions, John.
So this COVID thing is a problem, and it was a problem, and we lived with it, and it's still a problem.
Right.
And what do you recommend in terms of get the hydration, right? Got to come in.
What do you always say? What do we need to do? Take care of our own immune system.
That's right.
And the lymphatic is a very important part of the immune system. That's why I'm talking about it today. You've got to take care of your own immune system. You've got to move your own killer cells out there. You got to maintain this so that if you're exposed and you do manage to get it, you can get through it to the other side and, come back to life. I mean, I am really frustrated by the fact that people don't understand. You say to me, your old friend vitamin C, you're the one who says, I didn't get a cold.
That's right.
I didn't get a cold, right? Why? Because you maintain your immune system and you have comorbidities. You had to watch that.
Absolutely. And during that whole COVID scenario,
yes,
which we lived through,
yes,
and everybody was saying, you're going to get it. And I always felt like I was somewhat protected because of the vitamin C and the treatments I got.
And the other things that I did,
right,
including moving your lymphatics, which is part of my protocol. I have a whole protocol that utilizes homeopathics that move our lymphatic system so that it operates at an optimal level. And that's all we can do. John, if we don't take care of ourselves, let me tell you, all the shots in the world, all of this and that, if you're just not worrying about your health, man, you're in trouble.
Well, after all the treatments that I got, and I felt protected, but then I went and got the vaccine too.
That was fine. fine with me. I
Right.
said, go ahead, go.
Yeah.
I mean, I'm not an anti-vaxxer, but, I also know that there were people that were recommended from the physicians not to get the shot.
Yes.
And you know that.
Yes.
So I tell people, but I'll tell you one thing they always recommended. They recommended you come in and see the chair.
That's right.
Or my chair, not
That's
the
right.
chair.
Right. Your chair and the hydration
Right,
therapies.
exactly right.
Well, like I said, it was very, very, to me, it was very, very helpful.
Well, I agree, and I felt like we had an obligation to help people through this time. This was a terrible case, and if you were a primary care facility like we were, I made sure all my doctors were on call and ready to rock and roll, because guess what? We have an obligation to take care of people. That's what we do.
If you didn't have COVID and you're moving on with your life as we are all trying to do now,
Sure.
What do you recommend hydration therapies for? Is it for just overall good health, or is it for...
There's a whole lot of reasons to do hydration. Yes, it's for overall good health. It's to maintain proper antioxidant levels. It's to maintain your proper B vitamin levels. How about your bone density? How about using things for your bone density? We see that all the time. How about just helping us feel pretty good, keeping that brain fog at bay? You need a full nutritional regimen. And I don't care who you are today. The way we work in the world, there are so many toxins out there. We're breathing them in. The environmental issues are tremendous. Guess what? I think hydration as the vehicle to maintain your overall health, it's a very small price to pay.
People have said to me, and a friend of mine, you actually met him years ago, and he always says, you look so healthy. What are you getting? What are you doing? And I mentioned this, and then he met you, and he said, well, you're doing a good job with him.
Yes, I remember that. I remember that, John. And rightfully so. Look, John, bottom line, your health is in your hands. It really is.
Yeah, and everybody should take that advice.
I agree. I mean, yes, you lean on your physicians for advice and counsel. And when you're sick and you need an antibiotic or you need a drug, get it. But I'll tell you what, you also need to maintain your health.
You met this friend of mine who still has kidney issues, and I tell him, like, just about every day, you got to stop smoking. Well, what else am I going to do?
Well,
So some people have their own...
I know that, John. I know that. And I'll tell you, your kidneys are very, very important. And people laugh about it. I actually recommend a certain probiotic just for kidney function. So.
Okay, what do we have, about a minute, Jim? Okay, who is it? Monica? Oh, Lana and Cape May, real quick. Lana, good morning.
Hey, Lana.
And good morning to both of you. Dr.
Hey.
Molly, this is just a call to thank you for all you do, for all you read, for all you recommend.
Oh,
You're
my
the best. And
Lana,
I thank
you're
you
the best.
bottom of my heart.
Thank you, but you're the best, and Lucky's the best, and I got to say even Richard's okay in my
Right,
book.
yeah.
So you guys are
Yes.
wonderful, and you are a wonderful giving nurse, and I'll tell you what, we couldn't do anything without our nurses, so God bless you, Lana.
Okay. Lana, do us a
and
favor.
God bless you.
Next time, call a little earlier so we can talk to you a little bit. We are, in radio, it's called The Clock is Ticking, and we got to move on.
Thanks, Lana.
Okay. Thanks a lot for the call. And with that, we're going to put the wraps on another edition of Health Watch. Don't forget, operators standing by right now at Innovative Medical, and they'll be there well after we leave you at 9 o'clock. 856-489-0505. 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. The website, innovativemedicalassociates.com. innovativemedicalassociates.com. Don't forget, if you missed any of today's show live, we have our Health Watch replay 4 until 5 this afternoon here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, Joanne, fabulous Fran, and our nurses Jess and Crystal, I'm your host, John DeMasi. Thank you for listening. Have yourself a great week and a healthy one. We'll do it all over again next Sunday, 8 till 9, Health Watch, here on Talk Radio 1210 WPHT. You take care.